Kidney stones are hard crystalline structures that are formed within the kidney or urinary tract. Size of the kidney stone varies from the invisible as the head of the pin, almost invisible to the naked eye, to as big as 17 cm in diameter, and 2 pounds in weight. But the pain resulting from this small structure can be enormous. This educational video explanation is from Universal4trade Incorporation. Kidney stones formed when your urine contains more crystal-forming substances such as calcium, oxalate, phosphate and uric acid. These stick together to form kidney stones. Chemically, there are 5 major categories of kidney stones: calcium oxalate, calcium phosphates, struvite, uric acid and cystine. The most common is calcium oxalate. 85% are calcium oxalate. How is the stone formed? The first step is nucleation. When the urine becomes supersaturated, meaning thereby that when the urine solvent contains more solutes than it can hold in solution with one or more crystal-forming substances such as calcium, phosphate and oxalate in ionic form, a seed crystal may form through the process of nucleation. There are 2 kinds of nucleation. Crystals formed around the nucleus with the same compositions is called homogeneous nucleation. Crystals formed around the nucleus with the other organic materials like cell debris is called heterogeneous nucleation. This smallest crystal travel down the nephron and deposited at the renal papilla. Here they undergoes the next major change in its growth. Adhering to cells on the surface of a renal papilla, a seed crystal can grow and aggregate into a large organized mass. As it is seen, crystal can aggregate very quickly. For the factors unknown, these stones are reserved in the kidney, where they go on growing for an unspecified period of time. For the reason that is not understood, they are displaced and travel through the kidney into the ureter. If a stone continue to grow until it reaches a critical size, which can be as small as with 4 to 5 mm in diameter, the edges of the stone may become wedged inside the ureters at different ureteric sites like ureteropelvic junction, where the ureter crosses pelvic artery, or the uretrovesical junction. The result is scratches, bleeding, pain, spasm and obstructions, until the stone passes slowly out of ureter and bladder and ultimately out of body. Now let us examine the effect of addition of some of the lubricating substances on the surface of the inner lining of urinary system. See the smooth passage of stone, less scratches, less bleeding, less pain and easy expulsion of the stone out of the body. For more details about our products, please visit website www.universal4trade.com. Contact on email info@universal4trade.com.